All right, well, welcome everyone. We are happy that you are here today at our May provider meeting here in Butler County. We're happy that you could attend. I am Kathy Borders in Provider Relations here for Butler County. We also have Amy Winkler in the same position as me on the call with us today. She will be helping out in our chat box. We encourage you to use the chat box if you have questions throughout. You're also will be given opportunities to unmute and ask questions. We welcome interaction. It helps all of us be able to help you. So we are excited today. We have a couple of people with us today that we are going to start off with. First, we have, we'll start with Cassie Mattia. She is here from Butler County in our Community Connections team. So she's going to be sharing a couple of updates with us. I'll give it to you, Cassie.
Awesome. Thanks for having me. I really appreciate it. So yes, we have quite a few things going on here at Butler County. Quite a few things, so I'm pretty excited. The first thing, June 5th at the Joe Nuxall Miracle League Fields, we are going to have the first ever outdoor dance. So it's going to be pretty cool. I'm really excited. We're calling it the Summer Bash. So hopefully the weather is permitting. You know, you never know. But if you would like to attend that, like I said, it's going to be the first ever. It's going to be a lot of fun things, food, activities, decorations. You have to register by May 28th, which is coming up pretty quickly. So, and then, like I said, June 5th, I believe it's at 6 p.m. Is when we will have the Summer Bash outdoor dance. So, pretty excited about that. Um, Secondly, we are well, it's kind of right around the corner. We are getting ready for our 2025 Community Recognition Awards. If you've never been, we held it at the Butler County Fairgrounds last year in September. It was a circus theme, lots of fun. We had a great time. Basically, what this event is, it helps us celebrate the many unsung heroes whose work and advocacy make the world a better place for people with developmental disabilities. So, in saying that, this is going to be held at the Butler County Fairgrounds on September 18th. We don't have the exact time yet, but typically it starts at 5 or 6. People start arriving around 5 or 5:30. So we have several award categories this year, and we are taking nominations up until Friday, June 6th. So I will go ahead and drop that link in the chat and then tell you what awards we are actually giving out because we have a new one this year, which is pretty exciting. So I went ahead and dropped that link for the nominations there. So this year, the award categories will be Partner of the Year Award, Lifetime Achievement Award, Community Advocate Award, the Young Pioneer Award, Community Inclusion Award, Volunteer of the Year Award, and then the new one, which I'm really excited about. I pushed for this for like 3 years, so I'm pumped. We're gonna do an Outstanding Educator Award, which is a teacher. We've never done that, and I don't know why, but I'm pumped that we finally are. So that's one of our new categories. And lastly, the Community Impact Award. So to put in a nomination and see the full description, so you see exactly what it is, you can click that link and read the description of each award rather than me saying each description. Now, you probably don't want to hear that, but yeah, so go ahead and click that link and put those nominations in. We're taking them till June 6th. So you're really excited about that. Lastly, I always do pretty much every year since I've started, I like to do a grad photo campaign on social media. I love doing this. We get the best photos, the best reaction from the community with these photos. So, um, if you guys, anybody, literally, have a photo or photos of individuals we serve in the Butler County area that are graduating, please send them to me with the name of the individual, where they graduated from. And then if you want to have a little extra fun, you can ask the individual what their summer plans are or what they plan on doing if they graduated high school or college. What are they doing next? You can send that to my email, and I'll go ahead and drop that in the chat as well. I'm taking those now. I just posted one today, so I'm pretty excited about. We have another one posting tomorrow. I'm taking those now until like June, all through June. So just send them away. The only caveat to that is make sure you have a photo release. We don't want anybody to feel uncomfortable or get out there in the social media world that doesn't want to be out there. So just make sure they have that photo release. Other than that, like I said, I'll go ahead and drop my email. You can email me. Let me put that in there real quick. dd.org. You can email me those photos with those descriptions, and also email me if you have any questions about anything I just discussed. You know, something about the summer bash if you have a question, if you have a question about the community recognition awards, or if you have any questions about our summer grad campaign, please email me. Other than that, that's all I have. If anybody has questions or anything, definitely let me know.
All right. Well, Kathy, thank you so much. It's awesome. It's going to be a great summer. I'm
Yes.
excited. All right. Well, next up, we are excited to have Rachel Blick from DODD here with us today. She is going to be talking with us about the DSP compensation survey that is underway. It is required for certain providers. So we've asked her to come talk to us about that, explain to us a little bit, and hopefully we'll learn a lot. Welcome, Rachel.
Hi, can you guys hear me?
Yeah.
Okay. I had to call in using my phone. For some reason my audio doesn't work for Zoom, but it works for Teams but I think I figured it out though. Okay.
Perfect.
Let me share my screen. How much time do I have?
As much as you need. Yeah.
I wasn't planning on going on like every little minutia thing, but I did have some information that I wanted to share. And so every year we now have a requirement that provider agencies, so not independent providers, but agencies that provide either adult day services. Can you guys still see my screen?
Yes.
Okay. Adult day services and HPC in the prior calendar year are required to do the survey. And when I looked at Butler's claims data, that's about 158 providers. And across the state, we have about 1,900. Oops. It looked like it
Yeah.
booted me
Yeah.
out real quick.
Oh, sorry.
Let me see. Oh, it's okay. I think I need to just reinstall Zoom on my computer. It's so temperamental. Oh, can you see it now?
Yeah.
Okay. So yeah, so last service state calendar year, we had about 158 providers in Butler County offer adult day or HPC. And across the state, we're up to almost 1,900. So there's many providers and just one of me. So it's always good when I get a chance to talk to a larger group of people. One thing I did notice specifically about Butler County is there's not a lot of provider agencies billing for competency-based HPC. But if you have some DSPs who've worked for you for over 2 years and they do the required trainings, you can bill at a higher rate for HPC. Can you guys still see my screen?
Yeah.
Okay. For some reason, it keeps showing that it's booting me out. Can you see this next slide, this graph?
No, we're still on the required agencies in Butler County.
Okay.
Where's
So it I just have to keep signing in real quick.
um,
Hold on one second. And I did our training yesterday on my supervisor's laptop. So
um,
let's see. I'm getting back in, I think. Okay. Okay. Okay, so this year, oops.
Perfect.
Okay, so this year we are trying to do the data collection window in 10 weeks instead of 12 since we have our cutoff for our 2-year budget. But it does present some challenges for us. So usually by week 10. We had about 700 submissions last year, but this year we're hoping to double that to have 1,500. So I'm just recommending to providers to start their survey early in case they have any questions. I'll be able to give better, more prompt customer service if they start now than versus the last week when I have 1,000 people trying to do the survey. Um, but what I recommend for providers, if they haven't done it before or if they've had challenges in the past, to always use the Excel spreadsheet that is on our website and to just start out with the list of all the employees that worked with them last year and their start dates and end dates, and just to have their last pay stub information or their payroll data. And it does get a little challenging for me just to provide some of the guidance because I know agencies vary in size and they vary in their payroll information. Um, but I just recommend to go onto our website. You can just search for DSP compensation survey, or it's in the email that we send out to the DOO, the billing office, and primary email that we have in PSM. So we send out the survey link to them. New this year, I was able to get the survey links just to be the contract number without any leading zeros. There's only a couple agencies that have a leading zero. And hopefully they'll just keep the same code every year. And if they just have all of their payroll information ready with the work book that's on our website, it's pretty easy step by step of entering in your people when their start dates, their end dates, how many hours they worked in the previous year, and then how much in wages they worked. And then for some people get really tripped up when it comes to payroll taxes or fringe benefits or workers' compensation. So I would just recommend to people to see how much they paid in total in those. I realize some agencies don't offer fringe, but if they can see how much they paid total for their agency, and then they can make an assumption of, like, my staff, I have 10 staff, 6 are DSPs, so you can assume that like 60% of what you paid for those taxes or workers' comp premiums or fringe benefits went to your DSP. So you can do some assumptions around that. We don't audit the data, but we just ask that it's within those reference ranges. So if you can demonstrate that you pay your DSPs between minimum wage, which is 10.45 an hour, and 30 an hour, we're just looking that we can include it in there. Most are in between, I think, 15 and 18 these days. So we're not looking for perfection in the survey, but we're asking people just to try their best. And if they're having issues with their payroll data, one thing that you could do is just count up how many, full-time DSPs you have, how many part-time, and then you can just make an hour assumption, like, 20 hours for part-time, 40 for full-time, and just, multiply it by their hourly rate to get those annual hours or annual wages for people. So there's a few ways that you can be creative with it. We're really just looking at the average regular wage and then the average compensation total, because I know some people get tripped up of where do I put holiday pay and whatnot, and it's not so much like which line item you put it in, just as long as it's included in there somewhere. I keep getting kicked out here. I'm so sorry. But I was just
training. We can still see a training objectives.
like I'm not in Zoom at all.
It must be
So
frozen. Yeah.
I'm trying to get back.
While she's doing that, I'll just say this opened on April 15th and then closes on June 25th.
Mhm.
Just to remind you of those dates.
Yeah, I'm having too much trouble. What I can do though is I can send you the slides that I was going to share to send out with the group. But anyone could always email the box. I'll send that to you as well. And then we can set up a meeting, not on Zoom, but on Teams if someone wants me to help them with it step by step.
Perfect.
Okay, well, sorry for all the technical difficulties, but I'm glad I got to stop by and introduce myself. And yeah, and if anyone has any questions, feel free to reach out and we'll send you those materials.
Yeah, we can even see it. Does anyone have any questions right now that could be answered as a group kind of question while Rachel's here?
I want to ask a question. It's not a question, but maybe a suggestion or feedback. I finished the survey and then this year already, but I remember when I finished this one, last year I did the same thing. One thing confused me is no back button. They say, hey, you have to make sure you enter the correct. The Excel help, but no back button is really harder. We are human, right? We're careful doing it, but I just one suggestion. If the survey website they can improve a little bit better, that help. If it's not, we just survive. We still can finish. Just one feedback from my side.
Yeah, I would I've been trying to just get us to build an application for years where you can just look at everything before you hit submit. So I know that's like a limitation with the current survey. And I think one of the reasons they've explained, because every year I've asked for a back button, but they said because they do a lot of like quality checks as you go through that it like makes it harder. But I'm hoping if we can build a DoDD app that's like linked with claims that we would be able to get around that issue. Because I know it is tedious to work through that Excel book and then having to put everything into that survey screen by screen. So yeah, it's definitely not ideal for now. But it's at least giving us the data. But yeah, I'm hoping that we can build an app. I know it's this kind of data is required for the CMS access rule, but they haven't given out guidance yet for that because it was supposed to be a federal requirement in a few years. So I think we were waiting for a little bit more guidance and then we would build one in our system that would be compliant for the federal rules. But yeah, but yeah, we know the back button issue is not fun, but thank you for hanging in there for a few years before we get a more ideal permanent solution in place.
Thank you.
Awesome. Okay. Well, we really, really appreciate you coming. Sorry about the technology piece. Technology is great when it works, frustrating when it doesn't. So we will get your information out to our providers, your email address, and then any materials you want to send their way, we'll get that out. So thank you.
We have one more quick question, Kathy, in the chat. Does the survey show what we entered the previous year?
It does not, but if you email me, I can send it to you. So that's another downfall of having this like SurveyMonkey like platform is there's no like reporting on the back end. Like when I pull data, it's all on just one giant spreadsheet. And so it's not something I can like easily filter in. But yeah, I could retrieve that for you. I do recommend if agencies are filling out that Excel workbook, to save it somewhere on like a shared drive where people can access it year after year. But yeah, I can go back and find your data from last year.
Thank you.
I have a question. Sorry.
Sure.
I didn't receive the email from the.
Yeah. You can email me then. I know when we send out like those mail merges, when we have to send out to almost 2,000 people, sometimes they end up in people's spam or get flagged, or some people just have outdated email addresses. But if you email me, I'll send you your link to you and we'll get you my email.
Okay.
I'll send it out to the group.
Okay. Thank you.
All right.
Anybody else or? Yeah, I don't know if Rachel, if you're able to, you could even drop it in the chat, your email address. I was trying to quickly look it up and I'm having difficulty.
Yeah, let me see if I can get back in. I literally just kept
you're not
getting
even
kicked
in.
out.
Okay, yeah. Never mind. We'll get it out there.
Yeah, I'll email
I
it to
forgot.
you and then yeah. Okay.
Yeah, I have it for sure. But yeah, if we don't get it in the chat today, we will get it in our meeting minutes for sure. So
Okay.
thank you so much.
Thank you. Bye.
All right. Okay. Well, we are going to proceed on now with the rest of our meeting. We have a lot of provider updates for you today. There's updates, big things changing. That's why these meetings are so important to attend. And then also there are a lot of exciting training opportunities this year. So we are going to kind of just go through those. Feel free to drop questions you have in the chat or ask as we go along. So first thing up is that there is now new DoDD provider compliance tools that have been released for June. They were just updated in April, but they are being revised. They were revised again and effective June 1st. You know, there was a big MUI rule change that occurred, so that is part of it. The other important change that I wanted to point out here that we're hearing from DoDD is very important right now and kind of a focus for them is there were several additional settings questions added to the compliance tool. So these questions are addressing individual choice, independence, individual rights, and access to the community. So we are hearing that that will be an important part of any compliance review in the next probably long while. So it's really important to take a look at that, be familiar with the settings rule and also all of the tool requirements that are listed there. I have included the link here for accessing the new compliance tools. They are on the DoDD website on the compliance page. And then also there's training that they did that is linked there as well. If anyone has any questions on this topic. All right. Another exciting topic is EVV. So those of you that are using EVV or supposed to be using EVV, you probably have heard so much about it. You know what it is. So we're just here again to just strongly encourage you, for those of you that are providing HPC, PDHPC, residential respite, and any waiver nursing, that you are using EVV. Beginning October 1st, claims made will be denied if they do not have a matching EVV submission. So there will be a way to go back and fix mistakes or inaccuracies. However, all claims will be denied and you'll have to resubmit them. So we really don't want that to happen. We want as minimal disruption as possible with your billing. So we encourage you to begin now. October may seem like very far off, but it's going to be here very soon. And EVV, if you haven't been using it, takes a little while to get into and familiar with and get all the kind of kinks worked out. So it would be better if you're using it for a few months before that October 1st date comes. So we will give setup instructions today in our email that will come out after our meeting this afternoon that has setup steps for you. We encourage you to start that. Also, Sandata is now offering daily office hours where you can register and then they will actually pull you into a separate chat room if you need more one-on-one support. So that's really, really great a way to get support rather than calling the Sandata helpline number. We're hearing that this help desk is a much more effective way. They can see what you're doing, where you're stuck, and help you that way. Does anyone have any questions for us today about EVV? Okay, perfect. You're all using it and it's going wonderful. That is great, great, great. So if it is not going great for you, please feel free to reach out to us. We would love to help you or guide you in the right direction to get help. So I mentioned the MUI rule was revised, and that goes into effect on July 1st. I encourage you to take a look. There were a lot of major changes to that rule. There are several trainings being held right now by DODD that we would encourage you to attend at least one of those because the changes are so significant. There is a June 3rd webinar, so might be easier to attend that way. And then is also several in person throughout the state. The closest one to us coming up is in Hamilton County on June 10th. So that might be a great opportunity to go and get that, that training that way. So I've included the link to the rule there. It's kind of a long link there, but that's where it's currently posted. So please review that and be familiar with that. That will be a part of compliance reviews after July 1st. So you will want to make sure you're in compliance with that rule. Any questions for us on this topic?
Yeah, I do have a question. I attended the state information meeting, right? So they told me, oh, that information, now we do it, just FYI, we explain what MUI rule change affect, but it's not counting you get trained to know MUI. So that's I confused. And they said, oh, you will hear from us, and then there's more training coming. But I'm looking for which meeting give me certificate. Let me show when we got the audit. I already finished the training. So I register through the link DODD MUI change, right? I register meeting, but just FYI meeting, it's not a formal training. So that meeting already 1 hour, 2 hour, right? So, and also my question, okay, so as an agency director, we need trained. That meeting is not count. Which meeting account for director training? And when the MUI training change, I'm waiting for, I got trained. Do I certify to train my employee, or county, Ohio will provide some training for all the DSP? Then we can get, past the complaint. This, hey, this is a big change. Did you train all your employee? That's two issues. One is for me, director, the other for all DSP. How we got trained. It's not the information part.
Yes, so not all of DODD's what I'm calling trainings are official trainings that count towards, your annual training requirements or DOO training requirements. This is just, being compliant with rule is an overall requirement. So DODD is providing opportunities for providers to become familiar with the rule to help them be in compliant. So there is no requirement that you even have to attend this session. The requirement is you have to be in compliant with the rule. So this is a way to help you be in compliant. There would not be a training certificate like you were mentioning, because it's just an overview of the rule.
I see. Got it. Thank you for the information. I'm nervous. I'm thinking, oh my God, July is starting. I attended the meeting. Yeah. How I can prove I know it. Thank you so much.
Yeah, just in following it and doing all the requirements, that will be what what compliance would be looking at, that you're doing everything correctly.
Got it. Thank you.
All right. Moving on, our Butler County MUI department had a little reminder kind of going along with our MUI topic we were just on. Thought I'd stick this in there today. Just a reminder, there's kind of a trend happening where individuals with a guardian must have a consent for treatment signed by the guardian when they're taken for medical treatment. Hospitals are very busy and this is getting missed. And so it's a big issue. So we just ask that you as a provider to remind the medical facility or doctors at the time of medical treatment that they have a guardian, if that applies to that individual. Make sure that's getting communicated. All right. So DODD has announced that they are working on updating some provider certification dates to help them better distribute the number of certification renewals they're having each month. They are getting pretty backlogged with applications right now. So that processing is taking anywhere between 45 and 60 days. So to help that, so that in another 3 years, when it's renewal time again, they don't have the same problem again, they are just extending some certification dates. They don't necessarily tell you they did it. So the way that you can check is to log into PSM to see your expiration date if you were set to renew in 2025. You'll still get that 90-day email reminder that you can now begin recertification, but it just may be a little bit different. It's going to reflect what the new certification date is. If you got that extension, it's going to be 90 days from that new extended date, if that makes sense. Anyone have any questions about that? All right, something else I know you've been hearing about. I know as you log in, you've been getting alerts the last month at least about this multi-factor authentication that's being required now for PNM. So PNM is the site where you go to renew your certification, you add on services, you might change your agency DOO, your provider demographics like your address and phone. This is the site where you do all of that. It's not your billing, it's not your training, it's a different site than that. So if you are going to be doing any of those things right now, you're going to be prompted that you have to have multi-factor authentication set up, which just means you need to add a phone number and email address as second ways for them to verify your identity, just for security purposes. So if you haven't done that, there are instructions on it. It's pretty simple to do. It just takes a few minutes to get it set up. It's better to do it now. If you don't need to do any of those things in PNM this year, it's still better to do it now while the directions are readily available and you have that reminder rather than waiting until you need to get in there and you can't because you're locked out. So if you have any questions about that, we encourage you to reach out to Medicaid. Their email address and phone number is here. We will also be sending out the guide for setting up the multi-factor authentication as well today in our provider minutes. Wanted to let you know about a new DSP job opportunity website, a company called Sylphie's Media. They have launched a new DSP calling page where people can go to learn about being a DSP. There's a lot of really great informative and encouraging videos there that helps bring awareness to the DSP profession. You can, when accessing the site, you can not only learn about the profession, but then you can also actually search for DSP job opportunities that agencies have listed on Indeed. So that's a great way to, if you just simply have your job postings posted on Indeed, it's going to get pulled into the site because it's linked to Indeed by zip code. So this is a great way to post a reminder to post your own job needs on Indeed to get included, and then encourage you to take a look at this new site, dspcalling.com. We are here in Butler County. We are letting you know that we are going to be transitioning to a new provider portal that will go into effect on September 1st. So you may have heard about a new statewide provider portal that DODD supported with a large grant. A company called OnScene has developed a pretty great portal called Live Care Marketplace. It will be available for county boards to use across the state. It's not required though, so it may be a slow kind of trickle as county boards adopt this new portal. We, however, are excited to get on board with that and are starting September 1st. So our old provider portal will no longer receive any new service requests after September 1st. Everything will be in this Live Care Marketplace. You will receive an invitation from OnScene to register in the portal around July 1st. Somewhere in there is where we're going to start sending that out, those invitations. And there will also be training opportunities on how to use this new portal that will be provided by OnScene, and that will be communicated by them around that same time when you get those invitations. The important thing to know about this new portal is that in order to be included in the portal, you have to have listed on your DoD profile, your provider profile in PSM, when you got certified, when you've added services, you have to list Butler as a service county in your services. So yes, you are certified to provide services in all 88 Ohio counties as a provider, but to be included in our provider portal, if you do not have Butler listed as a county that you're wanting to work in, the Live Care Marketplace will not know to pull you into our Butler County portal. We will not be able to add you ourselves. The only way that you can be added is if you update your account in DODD. You will have to do it there. It is not an application. It is a fairly easy update. It just requires you logging in to PSM, and we will have instructions included in our meeting minutes today on how to do that, where to go to do that. If you do not want to provide services in Butler County, you don't want to be included in our portal, you would want to remove Butler from your service counties and or also not accept our invitation to register. Do you have any questions about this big change? Okay, well, if you do, feel free to reach out to Amy and I. Again, there will be lots of communication happening when all of this starts to take place here in another 6 weeks or so. We wanted to share with you a few new resources that have been made available by DODD. DODD's Wellness Project recently released a new Regulation of Adverse Reaction series. Really great resource to help someone work through anger, anxiety, fear, burnout. There's videos and activities that can be done, including there was even like a cooking activities and things like that. So a really cool resource to have for staff or anyone that might need those resources. There is also a new trauma-informed care intervention set of resources available by DODD. Great different videos and things there, tools there to encourage you to check out with those links here. We will send you this so you'll be able to click on the links easier too. Moving on to training opportunities, there's quite a few trainings we're going to share with you today. You're going to get this, so you won't have to write them all down right now, but just wanted to make you aware there's a lot of great things coming up. The SWOCOG has announced several. The first one coming up is June 18th, the Caregiver Stress Relief. Should be a really great one. That will be virtual. All of their training sessions will be in virtual, except for their September 4th one will be in person. So if that's something that interests you, that's a great opportunity to have that in-person training. There'll be more details as far as the time and things like that when it gets a little closer. They will post them on their website, and we will also share them in our provider meetings as we get those details. The registration link for the June 18th one is available. We will share that today and have a flyer to attach to our email this afternoon. The SWOCOG is also facilitating a accelerating wellness training series. There's going to be 5 parts to this training series. You can attend just all of them, they kind of build on one another, or you can just attend one or whichever one date maybe works for you. It's going to be a great training series that focuses on large trauma-informed mindsets, breaking that down into small, tangible, practical ways of being. Registration is available for this first one coming up here next week, May 27th. And then you have the dates for the rest of the year. This is a free training series. And again, the registration will be available on their website or in our provider meetings. We will send you out the flyer for this training series as well as a specific flyer for the May 27th training this afternoon. The Milestone Autism Resources has created a new 30-minute video and training resource to help people with complex need through a DODD grant. Just wanted to let you know that that's available out there for helping navigate challenging behaviors. in the community. So we wanted to provide that link to you to have those training resources available to you. Some more great things happening. So the Regional Autism Advisory Council at the University of Cincinnati is offering another session of their virtual training series for anyone to learn how to support employees with intellectual and developmental disabilities in the workplace, happening June 2nd from 11:30 to 1. It will be virtual, and the link to register is there. This specific training is going to be on the role of OOD and DDS when employing people with IDD. The Nisander Center is offering free virtual DSP trainings. It's through their Building Bridges DSP Echo program. There are 2 coming up. What's great about these training sessions is that DODD has approved them to be counted towards the 60-hour competency-based longevity add-on that's available for those DSPs or independents even that have worked 2 years or more, that this can count towards that 60-hour training requirement. We will have the registration information in the meeting minutes. It was a very long link, so I didn't want to put it up here today, but we'll get that for you if that's something that interests you. We are continuing our Butler County provider office hours. We love getting a chance to meet with providers a couple times a month. It's really great to put faces to names. Encourage you to attend if there's these topics that we're covering are of interest to you, or you're in need of a touch up on these topics. It's also a great way to meet other providers. So we are now, our sessions are now documentation and then compliance review. So those are each done once a month and repeated every single month. So we encourage you to attend. If you do attend, we ask that you bring your documentation records with you. It will help this be a more interactive training session. We'll actually go over exactly what you have and what you should have in for documentation, and then also for compliance reviews. These are held in person and you do not have to register. Our dates are posted on our website and also in our provider meeting communications. DODD has released 3 new job development trainings in My Learning. You access those just like you do your annual training in the My Learning portal. You would just go to additional courses to find these, or you can search them by these names here. The first 3 bullets here are the names of the actual courses. So it's really great that they are building up that employment, job development, data training base for you. Charting the Life course there is going to be a training happening for that, to learn more about that and to develop tools to support the people you serve or even yourself. That is going to be taking place on May 29th. It's on it's a virtual training. There's a registration link. Encourage you to check that out. It helps people with lived experience and families of all abilities and ages develop a vision for a good life, identify how to build support or find support, and discover what it takes to live the life they want to live. So very cool opportunity there. That will be just next week. Another DSP, I told you we had a lot of trainings to tell you about, a lot of exciting ones happening. So another DSP training opportunity. There's a company called We Thrive Together. They are offering a 6-month virtual training program. This is not free. There will be a cost. I'm not familiar with the cost, but it definitely sounds like a great program to look into to better equip DSPs with essential skills and knowledge to thrive. The training covers leadership, advocacy, personal growth, and mental health. So there's 6-month training series that one is starting in August and then another will start in November. So we have the website there for you to check that out if that's something that interests you. All right, that was all of our trainings and updates. So our next meeting is on July 16th. Would love to see you. We do have a little bit of time if anyone has any questions that maybe didn't get answered in the chat or anything else that you would like to ask about today?
Kathy?
Yeah.
I have a question. Under the classes for My Learning, as an independent provider, if you take some of the other, not courses, but classes that you all are offering, do you get any credit for those?
Yeah, so in My Learning, you do get a certificate for each class that you take, or it is going to appear on your transcript that you can access in My Learning. And then any trainings that you attend outside of My Learning, if you do not receive a certificate, there is a training template that DoDD has that you can fill out to document the training. It includes like the time, the date, the topic, that kind of thing. And that you can save those as part of your annual training requirements.
Okay.
So, you know, there are 8 hours required every year, right? As a provider, an independent provider or a DSP, there's 8 hours. So 2 of them have to be completed in My Learning. Those are required. They're specific trainings that DoDD wants everyone to have. So you can do that. There is a separation in My Learning to just take the 2 hours. And so if you do that way, then you get your additional 6 hours in other places. So either other topics that interest you in My Learning or any of these training opportunities we've shared today.
Okay, thank you.
Yeah, you're welcome. Anyone else?
We had a couple things in the chat. So a question about the current provider portal, the one that we do our claims on. So great question. That can get kind of confusing with the kind of portal talk and lingo. So the EMBS where you do the billing, that's not changing. That will stay the same on DoDD. So it's more so our internal Butler County DD portal, where you would receive referral requests to work with new individuals. That's the part that's changing to the new system. And then we had one other one about recertification. Dwayne, I'm happy you brought this up because DoDD is quite backlogged on these. So we've had providers submit even, I think, in March and haven't gone through yet. So they're aware and they are great at offering those extensions in those cases. So sometimes they're automatically doing that. We can check that for you to see if they've done that automatically. If not, there's a way to email and ask for that extension if you're getting close on that date you submitted and you haven't heard anything back yet.
We do encourage you to continue submitting your applications, or the earlier the better. I know some providers, you know, things are busy and you're waiting to the very last week or even the day of, but when you're doing that, then you're expired and not able to submit billing unless DoDD grants you that extension. So it's always better to get it in as early as you can.
I had a question regarding the independent provider requirement document list. Once you go through that, does that just get kept? Is that submitted anywhere? Or do we just keep that for our own records?
Are you talking about the required document list for a compliance review?
Yes.
And you're going through that yourself just to prepare for a compliance review?
I thought that's what I was supposed to do. I just printed it off. I thought it probably would be good, even if I'm not going to be reviewed, to have everything I need and then just.
That's great. You do not have to keep it or turn that in anywhere. That's a great way because that is basically the compliance review. They're going to be requesting to look at all those documents that apply on that list. There are many sometimes that don't apply to all individuals, like employment services or nursing and things that may not always apply. So yeah, that's a great thing to work through during our provider office hours, our compliance review prep. We're actually going through that required doc list. But you do not have to submit it anywhere or keep it.
Okay. All right. Thank you.
Mm-hmm. All right, well, great questions. We really appreciate you being here today. If you think of anything else after this meeting ends, feel free to always reach out to Amy or I. We would love to help you. I guess we will look forward to seeing you all at our next meeting. Have a great day.